So medical bills and prescription costs, they can be confusing and they can be really expensive, right? But there are a lot of ways to pay a lot less. So this Money Saving Monday, we're breaking down how to read your hospital bill. You can spot some common mistakes and even negotiate what you do owe. So joining us live in the studio with us is Scott Kelly, the CEO and founder of Solve Independent Insurance Associates. So this is a really interesting topic because a lot of people, they get that first hospital bill and it is a cringe. It can be a shock because they are almost all the time super expensive.
Absolutely.
So what, you don't pay the first one?
We always tell people don't pay the first bill. And a lot of people don't realize this, but you can actually ask the hospital to break down an itemized bill for you. And one hospital auditor told me that 100% of hospital bills have errors in them. An example, when my daughter was born, the hospital billed us for a circumcision. Obviously, she didn't have a circumcision, so they quickly took that off the bill. So make sure that everything that they're charging you for on that bill, you actually received that service.
How would you know? Because some of these things are medical terms. I mean, obviously that one's pretty obvious,
Yeah.
your daughter being born there. But what should, when you're looking at your hospital bill, what should you even be looking for?
Yeah, a lot of things you're not going to know. It's going to be medical terminology, but a lot can be, you can Google the CPT code or the ICD-9 code and see what it actually breaks down to and what they're billing for you. But those ICD-9 codes break it down to a very minute level that you can determine, you know what, I didn't receive that procedure, or they're billing me for the highest level of emergency room care and I didn't receive that kind of care. I got more of a level 2 or a level 3. So a lot of it, the average person can understand more than you think you could.
So how much could you save on this if you really go and negotiate with the hospital?
Yeah, so a lot of times hospitals bill at large multiples of Medicare, 600% of Medicare or 700% of Medicare. So there's a tremendous opportunity to bring in a savings below that. When a hospital bills, they typically nationally collect a little less than 50 cents for every dollar that they're billing.
Wow.
So if you're talking to the hospital, the next opportunity other than the itemized bill, the next opportunity is to negotiate. We go and we negotiate on that car we buy, we negotiate when we go to the garage sale for that furniture.
Yeah.
Why not negotiate on your health care? And one individual that I talked to, because I'm on the front lines a lot of times with employees, helping them manage their health care expenses. One person that I talked to, they had about a $5,000 bill. They had good insurance, but to have a baby, it still was $5,000 out of their pocket. Just by asking the hospital what they could receive in a discount by paying their bill right now up front, they got $1,000 off just for asking.
What should you ask the hospital before you have that procedure done?
That's a great question. So you always want to ask, what am I going to pay with my insurance? Bring out your insurance card, but also ask them what the cash price is. A lot of times the cash price is a fraction of what the insurance discount is.
Wow.
So one example for an emergency room visit, it's anywhere from $800 to $6,000, depending on which insurance carrier you have. The cash price is $257.
Let's talk about prescriptions really quick. What is the easiest way to save money? Because prescriptions a lot of times, they're a lot of money. I mean, they're drastically expensive.
Yes. This is probably the greatest opportunity for your viewers to save money is on their prescription drugs. A lot of us are on maintenance medications for our high blood pressure, our asthma, our diabetes. Ask your doctor for a generic medication. For 98% of the population, generic medications work just fine. Ask your doctor for a 90-day supply. Have them write that script for 90 days. 90-day drug will be less expensive than 3 30-day scripts. So those are a couple of opportunities. Another opportunity, when you go into that pharmacy, show them your ID card from your insurance company. But also, there's a lot of apps out there. The most common one is GoodRx. And that app, a lot of times, is less expensive than what you're going to pay with your insurance. One example, one person I talked to, they were paying $130 a month with their large insurance carriers discount, but that GoodRx app was $30 for the same medication.
Wow.
Yeah.
Scott, we're going to have you back.
That would be great.
You got a lot of good information there. And just really quick, is there help for people out there? Because we got to wrap the segment. But if somebody's like, how do I pay this off, the medical bill, is there any help out there for them?
Yes, there is. There's a lot of information on the website. You can get a lot of information from on different websites. One is called mdsave.com that helps you shop medical procedures like MRIs and things like that. There's a lot of help from your insurance carrier. Call the 800 number, look at their website. They have health coaching if people want to improve their health and get off of those medications. So there's a lot of research, a lot of resources out there.
Okay, there you go. Scott.